Hi, it's Jane, and I'm with Serendip PT in Easton, Maryland and Chester, Maryland. I'm a women's health physical therapist, board-certified women's clinical specialist, and a myofascial release expert therapist. So I'm here to talk to you about a common problem that my patients often come in and speak to me about, and that is urinary leakage during activities, namely high-intensity exercise, running, and often with jumping rope. So let's talk about what happens normally when the bladder is filling. So the bladder is filling all day, all throughout the day. Little by little, urine is dropping from our kidneys through the ureters into the bladder. The pelvic floor muscles, as well as the sphincter of the bladder, are compressing and maintaining continence while the bladder is filling, until bladder becomes full enough that the signal is given and the person goes and empties their bladder at the potty. During these high-intensity activities, the bladder is constantly descending, as well as all the organs, descending and slamming down into the pelvic floor. It's requiring superhuman strength and endurance to be able to maintain continence as the weight of the bladder and the weight of the organs is descending down and hitting into the pelvic floor muscles. If any muscles are weak or short, and short muscles are weak muscles, if any of those muscles are weak or short, then a person will not remain dry during these activities. Often, after birth or a surgery, a patient is unable to remain dry because the muscles are short or weak or uncoordinated. So when a person leaks, they tend to clench. Clenching your muscles makes them shorter. Short muscles are weak muscles. Power is force times distance. If the distance of the muscle is too short, you have to have superhuman strength of force to be able to get the power needed to maintain dryness during these activities. So what does one do about this? Well, first one has to determine if you're a clencher or if you have enough strength. So determine if you're a clencher. Do you have pelvic floor strength? Do you have painful intercourse? Sorry. So here's what one can do. Do a urine stop test. This is only a test. It's only to be done one time in a month. It is not a way to train your pelvic floor, despite what all the doctors and the magazines are telling you. So, can you, during urination, try and stop the urine? Can you stop it? Can you slow it down? Can you merely deflect it, or can you do nothing at all? Those 4 grades are important to be able to determine your strength of your pelvic floor. Determine if you have done Kegels. Do they make things better, or do they make things worse? Are you truly doing the Kegel is a question that needs to be looked at too. But do Kegels make things better or worse for you? If they make things worse, then you're probably a clencher. Do you have pain with intercourse? Can you bear down in your pelvic floor as if to push out a little urine? Not talking about straining, just bearing down. If you have issues with any of these, the urine stop test, painful intercourse, bearing down, or Kegels, then you may need to see a pelvic floor physical therapist. You're welcome to look on my website or to email me and ask questions for some self-help tips. Any women's health physical therapist should be able to help you determine a solution for your problem and give you some self-help tools. I encourage you to continue to stay strong, to do your activities, but to get help should you have trouble remaining dry during those activities that you love so much. This is Jane Franzak from Serendip PT, www.serendippt.com, 775-690-1211. I welcome your questions and input.